Thank you for that overwhelming introduction. It wasn't necessary, but I, uh, I probably represent a minority and represent the end user group in the healthcare service sector. It is indeed a privilege for me to be here at the India-Israel webinar series, Healthcare and Medical Innovations as a topic for discussion today. It is indeed an honor. Let me also mention Dr. Natasha Zangin, Dr. Haviv, Dr. Ganesh Prasad, Dr. Iran Cohen, Dr. Offer Harpak, Dr. Rajiv Chibar, Dr. JG, and our own Dr. M. Gopalan. Thank you, all of you, for allowing me to say a few words. We have, I have had the fortune of visiting Israel and attending one of the major healthcare exhibits. And I was really impressed by the scope of the whole project, by the extent of biomedical manufacturing in such a small country, which covers virtually the entire field of healthcare. And the high quality of the instrumentation was particularly impressive. So let me thank you for that opportunity also. As you know, Indian healthcare industry is on the upswing. We have 1.3 billion people, and we have a huge number of healthcare providers, majority of whom are in the private sector, and that is very unique to India. We are the fourth largest employer, and we anticipate 40 million jobs in the next 2 to 3 years. India is finally moving into the healthcare insurance sector, and we anticipate that a large number of the population will soon be insured, which means that there'll be more money pouring into the health science sector. The policies today are conducive. The people are very knowledgeable. There is rising income levels. The middle class is growing. There is growing health awareness. There is greater involvement in primary and preventive care medicine. The few key things that I would like to mention is the importance of the healthcare service sector interacting with the university and collaborating with the industry. That is something that does not happen, and that is culturally not typical for India. So what we would like to see happen more and more often is greater degree of collaboration and cooperation between the hospital service sector and the health sciences industry. And the reason why I say that is because when one collaborates in the industry, there are opportunities for operational excellence, clinical delivery excellence, decrease in cost due to strategic financial methods that can be brought to bear. So it really helps to have such meetings where the health service sector comes together with the industry, and the industry can understand the needs of the health service sector. The service sector can understand how the industry can promote their service activity. And so one of the areas, like for instance, one of the areas could be the industry helping in the educational process for residents and interns and medical students, nurses, technicians, biomedical engineers, and so on. They can be together and be able to train some of it and improve the skill sets, which further enhances the ability to provide healthcare at an affordable cost. That is one aspect of it. As we all know, all of us are going through the pandemic, and we all are experiencing day to day, the innovations that are brought to bear to control the infection. And that has taught us a great deal, although it is tragic, and the tragedy is beyond imagination. The extent of learning from this will help us in the years ahead. For instance, the industry has been very, very fast in putting together some of the key elements that helped patients to survive. Like, for instance, AI, vaccine development, rapid development of diagnostic tests, the fast action. And all of this we were able to do because the industry came in, worked with the service sector, and scaled up very, very rapidly. And even today, we are experiencing almost day to day the importance, for instance, the diagnostic test. It's hard to imagine that one can come up with an antigen test, a PCR-based test, an antibody test, all within a matter of months. It's unbelievable. And, and this is because today we have been able to, we live in an era where information moves very fast, and we are fortunate because that has enabled us to bring in all these innovations that undoubtedly has saved a large number of lives. Interestingly enough, what has enabled the scientific and technological innovation to come together and share the knowledge and resources, it's more of an offshoot of physics and engineering rather than biology. And that is very unique. And that's really important to realize because we tend to work in our own silos. We need to break out of those silos, work with the physicists, the engineers, the informatics people, and develop what is needed to save lives. So I think I should congratulate the biomedical industry, and we are really fortunate, and we're able to work with all of you and develop the necessary instrumentation to save the entire global community. So thank you for this opportunity, and we look forward to working with all of you.
Thank you. Thank you, Dr.